This is Martha Cortes here, a biological dentist from New York City. Spent over 20 years in practicing and studying on your aids.
Yes. I hate to admit it, it's 30 years.
Oh, 30 years.
But
oh.
I see plus 20. That's
well,
enough.
there we go.
In lasers, 25 years.
Oh, wow.
Which is highly unusual. It's like 0.01 when I started worldwide using lasers to stimulate bone, to actually increase the bone density. But what's really cool is the periodontal ligament. You can actually stimulate, that's wrapped around the tooth and actually causes more bone to erupt and also would increase the horizontal bone. It just took time. Diabetics, their diabetic index would decrease. People would sleep better because there's a lot of poisons, endotoxins that come from periodontal disease. But that's my beginning.
Yes. So tell me, so what started your research in this? And tell me a little bit about, your history getting involved into biological dentistry.
Being a biological dentist started right away. Like in '87, within a year, I was teaching cosmetic dentistry, teaching it. Then the lasers came into my world, and because of the lasers, you realize a lot of toxins and endotoxins. You go into the whole world of Fritz Pop. You go into the whole world of the spaces, the atoms, what is really the field. So everything you're trying to improve. Biological dentistry brings you into a realm even of thinking. The fields, even the thoughts. When I work as a biological dentist, I'm thoughtful in what I'm doing. What I'm thinking, what I'm putting. The other day, Jim was telling me that one of our patients over detox. My intention when I put in a CEREC, which is a non-plastic filling. Why? Because most women are estrogen mimicking agent sensitive now. There's too many materials that make their estrogen dominant. So I put a non-plastic, non-cement that had any plastic. Very well thought out. But when I worked on her, I intended of total detox to chelate naturally. Try to get the tissue to chelate naturally. She over-detoxed. Because there's so much intention in thought when you're working as a practitioner. So that's biological. Biological is laser, thinking about the biofilms, thinking about the materials, thinking about the interface, thinking about the bite. That's biological. The bite, for me, is a tool to C1. C1, C2 is what holds the neck up. There's a lot of proprioception here, which means you're doing feedback into the brain. You're keeping the brain stimulated. Dr. Klinghardt talks about the bite, the chewing. I've had people that have had too many teeth extracted. They have no stimulation. Some of them are even thinking about death. They have no purpose in life. I grant and help them get their bite back. Proprioception, the first time they hit it, their brain comes on, they don't feel like suicide, because it can happen. There are many, many unconscious, conscious thoughts that we don't realize just through the teeth, because it's a tool though. This tool that can open up the bite, open up this area. Very often people are compressed TMJ and C1, C2, they get migraines, occipital pain, depression. And as this compresses, they also may not get enough oxygen. That's why my block is called Breathe for Life, whatever it takes, whether it's opening up the bite with an orthotic, with porcelain, or working, make sure to open up the neck. Back here is both the respiratory center as well as the sleeping center. So if you affect this area, whether you're compressing it with the wrong bite, could be the orthodontics compress the whole teeth, they only worked with the teeth, and push the mouth, this area back, decreasing the respiratory space and now being a sleep apneic, or just insomnic or upper airway resistance syndrome means they can't really breathe very well, but they're not sleep apneic, but their hormones are going down. So this whole thing can be affected through the mouth. An exciting part now is that I teach this also. You can take the teeth, but you're really using as a instrument. Put an orthotic that pushes on the bone and you stretch the sutures. Just like the periodontal ligament, it can stretch and you can stimulate and you cause stem cells. So you can grow the jaw laterally as well as forward. So you can actually bring the jaw forward, sideways, and this jaw comes down and forward. You can treat the TMJ, you can treat sleep, FDA approved for sleep. changing what I used to think and get very sad about was that our human was shrinking, the face was shrinking, so now we just widen them with an orthotic at night, not just during the day. So they can walk around as if nothing was being done. No braces, nothing. But they wear it 12 hours, so they wear it evening, mornings, and their sleep space. It increases, remember Klinghardt talking about the slow wave sleep? You must have that deep sleep. It increases that sleep.
So what would you recommend for someone like me who I am 23 years old? I'm having some issues with, I believe, TMJ and within my mouth, and I'm told, you know, to go, or my teeth have been changing and shifting, and I'm told to just go to the orthodontist and just get it
No,
fixed.
it's not simple. The question would be, is why are the teeth shifting? What is it not congruent with? You should have all congruence in the whole body, should be congruent and being able to align correctly. The TMJ, C1, C2, the coccyx, the ankles, the shoulders, all should be in a line. If there is any problem between the teeth and shift, it's because the muscles, the bite, the jaws are not in the right position. The teeth may look pretty, but not the rest of you. And if you do leave it like that for a while, the teeth shifting a little bit, you may end up with migraines. You may end up with pain behind the eyes. You may end up with pain right in front here. You may end up with pain by the mastoids. You may end up in pain by the vertebra because the teeth are not congruent with the muscles. Most pain is 90% due to muscle. Incongruency with the structure. So the thing is to get the structure ready, or better. Improve the better. You would improve the face too. Why? Because it widens the cheekbones. It goes like this. And you have to still ask, where are the teeth and why did you need orthodontic treatment? Function. The adenoid issue as a kid. The ear infection. So those are all issues of function, not the right breath. So that underdeveloped the anatomy, so you have to open it up, bring the face forward. And I tease people, like, I'm going to put a snout on your face because I'm going to do something that's called a non-surgical osseous remodeling because you're moving the face forward and wide.
Great. Now tell me a little bit more about the Breathe for Life.
Okay. Well, what's interesting is a lot of my patients tell me stories how their life has changed when we open up their mouth. Their life has changed when we change some of their teeth. Instead of just putting veneers, we reconstruct the bite so that they have a better bite and they're horizontally, the shoulders right, the eyes right, the ears right. So that whatever it takes is because they obtain better things in their lives. So some of my patients go on the blog radio with me and talk about life. And Breathe for Life sometimes is doing yoga in addition to the dentistry, doing acupuncture in addition. They all end up with little networks of people helping them. Then they talk about their life experience. Sometimes it's even breaking up with a relationship or making a relationship because now they feel better about themselves. They breathe better. They have prettier teeth. They don't have to take naps in the afternoon because they're so exhausted.
That sounds familiar to me.
It does happen, and it's all about the breath. And the breath is also about the gut. Because you're not getting enough oxygen at night or into your system, you actually are not having a good gut. The gut needs oxygen. It is one of the best nutrients, sunshine and oxygen. So I interview all these people on it.
Amazing. And now where can we find out more information about you?
I'm in New York City. I'm on Central Park South by the park.
Yes, and
phone
your
number?
blog
The blog. Okay, well, the easiest thing is the website.
Oh, the
It's
website, yes.
Cortes Advanced Dentistry.
Beautiful.
Yeah.
Well,
and
great.
there's many pages, and it's a cosmetic website. Some befores and afters. It talks about periodontal disease with the laser because it changes the whole thing. You're changing the biofilms, the bacteria, but you're bringing oxygen in also and stem cells. And it talks about where I teach in the office with the other doctors and chiropractors and medical doctors.